Hey guys, and welcome back to my channel. So this video was influenced by one of my subscribers, and he actually asked two questions, but today I'm going to focus on his second question. But the second question that I'm going to be answering in this video, it goes like this: how do nursing ranks work in theater? Like, would you get a registered scrub nurse and an enrolled scrub nurse, or would one rank be a scrub nurse and the other rank be a nurse anesthetist? So the reason why I wanted to cover this video is, one, I just finished my theater rotation, so it's a good time for me to answer all the questions regarding theater. The second thing is because you guys ask a lot of questions about theater and how that whole process works, and also in addition to that, you guys want to know how to become nurse anesthetists, so I'm going to be covering all those things in this video. So theater nurses are nurses that are offering comprehensive specialized care in a specialized unit. They are characterized as a scrub nurse, anesthetic nurse, circulating or floor nurse, and recovering nurse, and they all function within their scope of practice as a professional nurse according to the Nursing Act. So to begin with, we have our scrub nurses, or they're also known as your peri-operative nurse specialist, which is a professional nurse and midwife who has a postgraduate diploma and they specialize in the peri-operative field. So he or she will prepare and control the instrumentation, the swabs, the shops, everything that has to do with the operation being performed. However, they are not assistant surgeons. As a result, they cannot suction, they cannot cut anything on the patient. Their duty is to make sure that they're passing the right equipment to the surgeon or the doctor, and to make sure that every single instrument, swab, suture, etc. that is used is accounted for after the operation. So your circulating or your floor nurse is usually your enrolled nurse or your ENAs. So this is the nurse who supplies the scrub nurse with any sterile items that might be needed during an operation. So your scrub nurse at the beginning of the operation, they have a pack that is dedicated to that operation that is being done, that they'll open and prepare, and they'll prepare as much equipment that they'll need for that operation. However, during the whole procedure, there might be other instruments, other sutures that need to be opened. As a result, the scrub nurse is there to perform these duties, because once the scrub nurse has entered the station, they cannot leave it or they'll break the aseptic technique. And lastly, you have your recovery nurse who assists the patient to recover post-operatively, to make sure that the anesthetic wears off nicely, to make sure that the patient is orientated and they're coping well to the anesthesia and that sort of thing, because the anesthesia, especially your general one, can be quite aggressive, and most patients, after they come out of it, they can be quite combative, they have loss of consciousness, that sort of thing. So they need to make sure that the patient is adjusting well after anesthesia. Usually the patient will come from theater, then they're taken to the recovery room, and then from there the anesthetics make sure that the patient is recovering well, and then they sign it off. Then the recovery nurse is the one that stays with the patient to make sure that the anesthesia is wearing off as quickly as it should be, and then you need to make sure that you're taking vital signs every 15 minutes, or I think it's actually every 5 minutes, to make sure that the patient is coping. Once the anesthesia has wear off, or to a point where they say it's safe for the patient to go back to the ward, and then obviously if the vital signs are stable enough, then the patient can be transferred back to their ward. So just to give you a proper rundown of how all these roles come together. So you've got the doctors, they go to the patient in the ward and they say, cool, this patient needs surgery. So the nursing staff from that ward, let's say it's a surgical ward, they bring the patient to theater. Then any nurse or even the anesthesia and the doctor can take over the patient. So if you're a nursing student, you most probably have handed over the patient or taken over the patient when you come to theater. So the patient comes in, the nurse, the doctor, whoever is taking over the patient, you need to check the ID band and you check it against the consent form to make sure it's the right patient. Then you need to make sure that your patient hasn't eaten, they don't have any underwear, socks, dentures, earrings, belly rings, that sort of thing, because those things can be very harmful to your patient, because we've got this negative electrode that they use to cut the patient. So if the patient has any metal, it will burn them. So that's why it's important to check for that. Then you also make sure that the patient hasn't eaten over the last 24 hours. You also make sure that you check that the patient actually knows why they're here, what operation is happening. If they're having any leg or limb operation, please make sure that you check that the consent form has the right limb, because I've actually had a case where the doctor wrote that it's the right limb, but the patient tells you no, it's the left one. So you need to make sure that what the patient is saying and what the doctor wrote is matching up. If it's not, it needs to be fixed. Then you obviously need to check if the patient has any allergies or any other comorbidities that need to be checked. So your diabetes, your high blood pressure, those are important things that you need to be aware of when a patient is going into theater. You take the patient to the pre-operative room. So when they enter this room, the anesthetic team comes in. Then to make sure that the patient is aware of what operation is happening, they explain to the patient what type of anesthetic is going to be used. So you can either have a local one where it's just in a secluded area, so then you've got your spinal where they numb you from the waist downwards, and then you've got your general where they put you under and you are asleep and you're connected to an intubation machine to help you breathe and that sort of thing. So the anesthetic team deals with that. They explain to the patient what's going to happen, how it's going to happen, and then they also make sure that the patient has been put on a drip. So now comes the question, do nurse anesthetists come into this equation? Personally, I've worked at 2 different hospitals and I've never seen a nurse anesthetist. And I looked on the SANG website on all their postgraduate diplomas, and nurse anesthesia or anesthesia specialization is not part of that list. So under the nursing field, from a South African point of view, we don't have that. But SANG and DENOSA, they both are aware that nurse anesthetists exist, obviously not in a South African context, or if they do, they're not trained in South Africa. So if you want to be a nurse anesthetist, you would have to obviously go get trained somewhere else and then come back and work here. But I'm not sure how that process would work, because obviously there's no scope of practice for what a nurse anesthetist can do in a South African context. And I'm not sure if SACA would evaluate a certificate from outside to work in South Africa. So that's a whole thing. So I'm going to read a statement that DENOSA made. It says, in South Africa, anesthesia is only administered by medical practitioners, which is in the line with your scope of practice. The practice has never been in line in the South African nursing practice. For patients, anesthesia offers freedom from pain and facilitates medical treatments from the most common to the life-saving. Doctor-to-patient ratio in South Africa is usually 55 to 100,000 patients, which varies from province to province and given situations. The above situation is only a third compared to developed countries. In the United States, nurse anesthetists are among the first providers of anesthesia and have been administering it successfully for more than 100 years. The introduction of nurse anesthetists in South Africa would bring more relief to the already understaffed and overworked medical practitioners. So I'll have a link down in the description box to this article where it explains the whole vision that DENOSA has. So obviously DENOSA is fighting that we have nurse anesthetists in South Africa, but as of currently of making this video, they do not exist, or they are not trained in a South African context, and I've never seen them in a South African hospital. If they exist and if they're watching this video, please comment down below and let us know. What do you do? How does that process work? But even in this article, DENOSA was also saying that even with theater nurses, there is not a specified scope of practice of what they can or can't do in a theater setting and that sort of thing. So that's one thing that SANG has to work through, that if you are a nurse in South Africa and you go outside like the United States and you get trained as a nurse anesthetist, if you come back to South Africa, can you use your qualification as a nurse anesthetist? Where does SACWA come in? What is the scope of practice and that sort of thing? So those are things that the future generation will have to inquire, fight about, if we really want to have nurse anesthetists in South Africa.
So I was busy editing and I realized I didn't finish my thought process. So after the patient is taken into the pre-op room, then we take the patient from there. They have their drip on and they've been explained what the procedure will be. We take them into the operating theater. In the operating theater, that's where your circulating and your flow nurse really strive, because at this moment in time your scrub nurse is busy preparing the equipment, they're opening it up, making sure that they have everything and that sort of thing. So they're in the, it's like a preparation room which is next door to the operating room. The patient comes into the operating room with their bed, then we transfer them on the operating table, and then we need to make sure that we're covering them with what we call the body, which is like a warming blanket, and then the anesthetic team will make sure that the patient either has their local, their spinal anesthesia, or their general. They put on the ventilation machine. So the anesthetic team is the one that's going to be making sure that the patient is asleep during the whole operation, and they make sure that they have fluids. Every time a patient comes into theater, they need to make sure that they have plasma light because of all the fluid loss that's going to happen. And then as the process is going further, There's a whole monitor that they have where it checks the patient's vital signs like literally every single minute, and they need to make sure that it's correct. If they see that the blood pressure is dropping, then they increase their fluids. That's where you have Voluven and that sort of thing. So the anesthetic team is there to make sure that the patient does not collapse while the surgeons are operating. Then the circulating nurse makes sure that the anesthetic team has their checklist. They make sure that all the water that is going to be needed, the saline, it needs to be warm. Any equipment that needs to be moved in, like sometimes we have x-rays during the operation, especially your ortho cases. And then we also assist the anesthetists when they're doing like spinal. There's a whole spinal tray. So we make sure that the anesthetist doctor is maintaining aseptic technique when they're putting the spinal. So pretty much the circulating and the flow nurse really thrive in this space because they make sure that everyone has everything that they need. They make sure that the patient is comfortable, all the leads that need to be connected, your suction, pretty much they run the theater at that moment in time. And then the surgeon will come in, then there's a whole checklist that happens. I'm sure we all know this famous scene where they'll be like, I'm doctor or I'm surgeon so-and-so, I'm going to be performing this procedure. Then the anesthetic team comes in and say, I'm anesthetist so-and-so. And they give a brief history of what operation is going to be happening. And then the scrub nurse introduces themselves. Unfortunately, it doesn't always happen, but that's what's supposed to happen. And then everyone introduces themselves, and then they get the scalpel. They don't announce that scalpel, but in movies they make it very dramatic, but that's when it all starts. So on the operating table, you have the surgeon. Usually they'll have an assistant or sometimes they are alone with their scrub next to them, giving them the equipment. Then the circulating nurse will be passing equipment that they need. Like for example, they need warm normal saline when they're putting any swabs into the stomach or whatever. So the circulating nurse is the one who pours the water because the scrub nurse can't touch anything that's not sterile, that they haven't opened on their tray and on their food. So it's a whole long process. So the operation happens, it can take from 45 minutes to 2.5 hours, and you literally just have to sit there, watch, inhale all the smells that come up. It's a whole process and a half. After the operation is done, the circulating nurse and the scrub nurse and the surgeon make sure that the patient is comfortable. All the equipment is taken to the sluice room, and then it all gets cleaned out. It goes to the CSSD team to sterilize and that sort of thing. So the patient is taken out of the anesthesia by the anesthetic team. Then you put them back onto their bed, and then off they go to the recovery room where the recovery nurse takes over and they're doing their vital signs. The anesthetic team also needs to sign off that the patient is awake enough for them to go back to the ward. So honestly, out of everything that happens, the circulating nurse does a lot of work because the scrub nurse, in a sense, incapacitated to their chair, because they need to keep the aseptic technique while they are doing the operation. So the circulating nurse or the floor nurse, and I know in some cases they call them the runner nurse, literally you are running up and down trying to collect all the equipment that is needed. If you can't find it, then you need to ask someone. You go into the storeroom. It's a whole long process, and sometimes like even your suction tube or the suction container gets really full. Quick backstory or quick story on that. So there was a theater kids were doing, and they had like 5 liters of water for irrigation that was going through. So the irrigation water would come, they clean the patient, and the suction is happening at the same time. So water is coming in and water is going to the suction container. So the suction container is getting full, and I was supposed to go and change it. So it's literally a bag that you take out and then you put another one. So silly me being all eager and excited, I forgot to switch off the suction. So when I removed the bag from where the suction is happening, all the water, all the contents coming from the patient just spilled out on top of me. And now I'm trying to hold that suction thing so the water doesn't continue overflowing. It's in the middle of a whole operation. I was so embarrassed. Like, I was just beyond mortified. But anyway, I had to keep a straight face. I took out the container. I eventually switched off the suction. I put another one. And the whole operating theater was flooded with all the contents that were coming from the patient. Like, oh, I was so embarrassed that day. I was like, oh my gosh, what was happening? But anyway, let's get back to where I was in the original video.
So just to properly answer your question, Seth, how the ranking would work, you would have your perioperative nurse specialist, which is your scrub nurse, and then you have your recovery nurse, because your recovery nurse can either be a general registered nurse or a perioperative nurse specialist. And then you've got your circulating or your floor nurse, which is your EN or ENAs, which is where also your nursing students will fall under. If a nurse anesthetist was to be in the picture, then obviously I think they would fall under the same level as your perioperative nurse specialist. I don't think they would fall under the rank of the doctors, but I hope you understand. So I really hope I've answered your questions and I've gotten you guys thinking about this whole nurse anesthetist and the future of nursing going forward. And obviously, as the future generation of nurses, it technically is our job to be able to fight for those things, because it will help with the understaffing that we have both in the medical field and in the nursing field. But then obviously it begs the question, if you're a nurse anesthetist, do you fall under nursing or do you fall under medicine? Because technically you're doing a job that a medicine student would do. But that's a whole very interesting conversation going forward. So until next week Friday at 12 p.m. South African time, have an awesome one. Bye guys.